Do you think as a country we have handled the COVID-19 pandemic appropriately?
As a country, we got everything wrong from the beginning. The whole thing was handled in a very casual way. The whole thing was handled with some sort of arrogance. And I would say the whole COVID issue was handled the same way our economy and country has been run for the past 8 years. So you have people who are so disconnected with the reality. You have people who do not understand the people they are leading to a level where there are international drums beating. There's a global pandemic. We are getting information, but at the end of the day, as a country, there is what I call the executive arrogance that has driven these people to heavens that only them understand, to a level where they can never understand. They don't feel the pain of the people. So you discover that even with all the global warnings from the developed countries, we as a very underdeveloped country could not take heed. And that's why it was very embarrassing to hear the former Prime Minister even going to an extent of telling us not to shut the Chinese out because that would be discriminatory. So that just shows the level of insensitivity to the welfare of the people that we had. So from day one, we even go back to the situation where there was that KA, was it KA?
KQ.
The KQ, was it KQ or KA? The employee who took photos and shared, just as a warning to Kenyans that countrymen, as much as we think we are okay, things are not okay because we have a situation where we have a hot zone of the pandemic. Other countries have already locked out China from flying into their countries, but as a country with zero capacity to handle anything, we are there exposing ourselves to a level where we are willing to even punish our own patriots for having communicated. So you find that from the onset, it was handled very poorly. We go the same to every other thing that happened. So it was just chaos from the beginning, emotions from the beginning, and lack of sensitivity to the welfare of the people.
Okay. Do you think the lockdown are necessary right now?
The lockdowns are necessary, but unfortunately we do not have an economy that can sustain, can withstand the effects of such lockdowns. So you discover that COVID-19 is real. It's not a Kenyan problem. It's not an African problem. It's a global issue that has torn down even the superpowers. The United States of America, the UK, they can't lock down their economy and shut down critical areas of the economy like even sports if it wasn't a serious thing. So the lockdowns are necessary, but unfortunately we know we are a hand-to-mouth economy. So in a hand-to-mouth economy that has already been run down by an inconsiderate administration that is so disconnected from reality and the plight of its people, it's very difficult for it to lock down a country because the global statistics, the global mortality statistics from hunger is around 8.9 to around 10%. The global statistics for COVID-19 is around 2 to 3%, 3 point something percent. So we have a situation where you're exposing people to a 10% mortality rate pandemic while pretending to save from let's say 3% one. So at the end of the day, lockdowns are only effective and they serve their purpose when you have measures that cushion the citizens. You cannot have a lockdown, you cannot shut people in their houses without alternatives. You cannot shut down schools, you cannot shut down, I'm talking about schools, yes, you're protecting the children, but there's the business side. So at the end of the day, lockdowns are good, but we must have measures that our government has refused to even attempt to try to put in place. Because at the end of the day, you just find it's just a matter of misplaced priorities. And we can't say we don't have money, because recently Parliament passed a supplementary budget. In that supplementary budget, there was 8 billion for the expressway. So you just ask yourself, what is this hurry with some of these things? When we have a pandemic, we have serious issues, people are dying. At the moment, we are talking about the vaccines and stuff like that. But at the end of the day, you discover that we have just a government that is insensitive, lost its touch with the people, misplaced priorities. And at the end of the day, you just look at all the decisions that are made are anti-people.
So what do you think should have been done differently?
Personally, I think I've mentioned this in other forums, even on radio stations I've been to. And personally, I look at where we started from. As a country, even before we get to where we started from, we enacted this, how do we put it? We promulgated this constitution with the devolution as one of the key issues. Devolution was not just about, okay, there is always that perception, and sometimes I'm tempted to believe it, that devolution was just meant to create positions for the political class, devolve corruption and stuff like that. But at the end of the day, if Kenyans are not getting value relative to the investment that is made, then that assumption is true. Because at the end of the day, devolution was supposed to bring resources to the people. Resources, we are talking about the basics. We start with things like education. Because an economy is built on 4 pillars. We talk of education, we talk of health, we talk of security. Yeah, those 3 key pillars are the builders of the economy. Without those, an economy will never prosper. So health as a key pillar, we were supposed to have invested, because we live in a country where we only had Kenyatta National Hospital, Moi Teaching and Referral, Kakamega, the Kisumu, the Mombasa were just by the ways. So we were supposed to have invested. So for this thing to have been handled differently, we failed. The county governments failed. But then we were in the middle of a pandemic. We were supposed to have invested immediately. When the lockdowns came in, the civil servants, those above 58 years and above, were told to work from home. So I asked myself, and I'm touching on this just to remind people that we don't have a problem with the resources. Because I asked myself, the 58 plus and above, some of them were being driven in government vehicles. Which means when these people started working from home, they weren't being driven, which means there were no fuel costs that were being incurred, which means there were no service costs that were being incurred because this person is at home, so we know the vehicle should be parked. So these are some of the resources. Before we even go to our usual begging mentality of having to go out there and look for money, we already had savings because people are working from home, which means the government is no longer spending. I have friends who work for the government. They were no longer going for these trips, which means we are saving money, the per diems and all that stuff. People are no longer coming to the office. That money was supposed to be pumped direct to the grassroots, where we talk about, I used that as a simple example. We saw the example of Rwanda building something great. We saw China and stuff like that, and we were surprised that these things could happen. We even had a health here saying that no country has done that. You look at that level of. So you understand that the example I gave is that we could just have done, for example, the containers. Take a 40-feet container. It would cost like $500,000 to fabricate and have a COVID center in each ward. So you already know that as an economy you cannot sustain a lockdown. Because at the end of the day we have a country that does not, we have a government that does not understand the people we lead. So what we should have done was to invest in grassroots healthcare. Once we have invested in grassroots healthcare, we've taken away the pressure that we are seeing in private hospitals and the big hospitals. Once we have that, now we focus on, we educate the citizens. And as the citizens, we insist on the wearing of masks, the sanitization and all that stuff. And we regulate the way people do business. We had talked of regulation of the people in churches. We had talked of reduce matatu occupancy. We've talked of takeaways and stuff like that. And this, I even go to an extent of saying, instead of shutting down the hotels and sending everyone home, why don't you even, and this goes the same to the hotel owners. You had 10 employees. The restaurants are takeaways. Instead of firing 7 or firing 5 so that you remain with 5, why don't you retain all of them and then decide we work 3 day shifts so that you earn half a salary? So as much as we talk of the government, we as a citizen, as a business people, we have lost the creativity. So at the end of the day, everything would have been done differently. From the way the lockdowns were being implemented, to the measures that the government never took, instead of trying to alleviate the suffering of the citizens, the government went on its own infrastructure businesses. They went on with their BBI and all that stuff. So that's the insensitivity I'm talking about. So yes, things would have been done differently from day one to date.
Okay. Do you think the Kenyan citizens are to blame?
To some extent, I would say yes. But at the same time, you look at where Kenyan citizens are coming from. Kenyan citizens are being led by a government whose president lied to class 1 children that will give them laptops. Kenyan people are being led by a government that promised 5 stadiums, upgraded to 9, that never came into reality. Kenyan citizens are living in a country where they were promised electric trains, but we only turned up to see 1930 diesel locomotives. So with such a background, I think I will understand Kenyans, because at the end of the day, we are an emotional country. You see the way people are teased during elections with those slogans. It's the same thing that is happening with COVID. So we are at a point where Kenyans do not trust the government because they have no reason whatsoever to trust the government. So even whatever the government tells them, especially when it's a situation where the government is not giving them alternative avenues for progress, I would understand Kenyans. But at the end of the day, as a person, you get to a point where you try to take care of yourself. Under whatever circumstances, you can't fight a war unless you're alive. So we have to try and... So there's a bit of a blame on Kenyans, but I think for Kenyans, I excuse Kenyans. Because at the end of the day, I usually tell people, why would a government build roads in a country where people... Let me give you this. I usually use this assertion. People leave their houses for 2 reasons. You leave your house to either go make money or spend money. To make money, you're either going to do business which has been shut down. To make money, you're going to work. Hotels have been shut down. Transport is chaotic and all that stuff. So there's nowhere for people to go make money. So people have no reason to step out of the house. Those who have made money are supposed to leave the houses to go spend money. It doesn't matter whether you are jogging, whether you're going to buy something, whether you're just taking a stroll, you're spending money. Because even when you're taking a stroll and think you're doing nothing, there's wear and tear on your shoes. So you're spending, your clothes getting dirty, you'll spend. So at the end of the day, we're in a situation where we have a government that is spending on infrastructure and people are dying. So for whom are you building the roads? For whom are you bringing the new constitution if the people are dying? So I understand Kenyans, and that's why it's a bit of... I put 75% on the government, I put 25% on Kenyans.
Oh,